Welcome to my channel once again. Today we are going to continue with the care plan, and this is the part 3. And then we are going to look at the last aspect of the care plan. Good. So here this is the medical orders, and then it carries 2 mark in total. The medication side has 1 mark, other treatment has half mark, then the investigation side has half mark. Remember, as little as this mark is, it plays a cardinal role for you in achieving a good mark to pass the nursing care plan. Alright, so let's look at this example to get ourselves oriented on how we fill this portion of the care plan. So technically, we have a date ordered for the medication. During this period, you'll be given access to the patient folder or patient information via the electronic system. So automatically, that side should contain the medication the patient is on. So yours is to write a date that the medication is being prescribed or ordered, and then the medication is also, if it is Cipro, IV Cipro 400 milligram BD times 24 hours. If it is tablet paracetamol, you can write tab paracetamol 1 gram BD times 24 hours. So the medication you see there is what you write, and then the date it's completed. So if it's not completed, that's right, not yet completed. Right. You move to the next medication, put it there, repeat the same thing as it goes. Here it's only 2 marks, so you don't need to write all the medication. At least 3 will be good. 3 will be good. And then in case all the medications are not completed, you can easily write not completed boldly across this line so that you don't waste much time writing not completed, not completed, not completed, not yet completed. Just write it straightforward across this line. You have your 1 mark in your bag. Good. Then you go to other treatments. So with other treatments, it refers to other intervention given to the patient aside the medications. Right. So example, blood transfusion, physiotherapy, radiotherapy, oxygen therapy, cognitive therapy, nutritional therapy, etc. If it is done, it will be in the folder or the electronic system. So just write a date. What is mean done? Blood transfusion, which one? Whole blood or packed cells or frozen plasma? So if it's whole blood, you indicate whole blood. And if it's completed, you write a date. If it's not yet completed, not yet completed. The same apply for the rest. You don't need to write all because of time. So write a few as much as possible and then go on. And if it's not completed for all of them, just write boldly across here, not yet completed once. But if the patient comes and then has not been put under any other treatment, just write across no other treatment done or no other treatment ordered. You just write across from here straight, like the way I've written over here, from this section straight, no other treatment done or ordered. You get your half mark. Then you quickly rush to the investigation time. So here, the lab investigation that the patient has done, write them here, the date, and then the investigation, and then the results. So the date, the patient has blood film for malaria parasite, so no malaria parasite thing. If there's a malaria parasite, you write the number of parasite there. If this full blood count, write full blood count. Pick the important component of it, the white blood cells, red blood cells, and the hemoglobin. Write the values down. You are done. If it's without test, put the result there. Very simple. You don't need to write all the investigation because of time. At least 3 will do, and you are done. So this is the easiest part that you can get your 2 mark. Add it to the first page where you are supposed to get 6 mark. Automatically, if you do well, you should get 4. So automatically with these two sides, you have 6 mark in advance before you move to the part 2 of the nursing care plan, which is the nursing care plan itself. Good. That is where you have to fill the patient's diagnosis as well, intervention, evaluation, the orders. That's good. So we are done with this portion. So when you have time, try this on your own. In addition, when you have this in an examining scenario or situation, this side and then the front page are the easiest one. So those ones you have them at your fingertips. So get them done and make sure you get your bonus mark before you now move into the major section where you have to come up with a lot of writing. You get it. Thank you for your time. And then next time we'll continue with other topics that are very relevant into this section that we are now in.